You're listening to the Aesthetically Speaking podcast, presented by Nextech.
Hey guys, welcome back to the Aesthetically Speaking podcast, presented by Nextech. I'm your host, Tyler Terry, and today we not only have a very special guest, he's one of the most prestigious, in my opinion, plastic surgeons in the country and one of the best, somebody that I would trust my friends and family with. His name is Dr. Michael Edwards. And I'm so excited to have him share his wealth of knowledge on the podcast. Dr. Edwards, welcome to the show.
Thanks. Great to be here.
Yeah, well, I want to kick it off by turning the time over to you to just tell us a little bit about you and your background and your practice.
I am in a group plastic surgery practice in Las Vegas, Nevada. I have two incredible partners. We have a dermatologist, Dr. Allison Tam, on staff. We have 3 nurse injectors, 4 estheticians, and a host of incredible support staff. We have operating rooms upstairs, so it's really a wonderful place to work, somewhere where I think any plastic surgeon would be honored to be a part of. So that's where I am now. I've been in the medical field a long time. I started off as a medical assistant. I was a house orderly. I pushed gurneys around the hospital. I used to assist with autopsies, culminating in going to nursing school, working intensive care and ER nursing jobs while I was then in undergrad for medical school. And I went to medical school through the Air Force. And so I went to a medical school called Uniformed Services University, where in addition to medical curriculum, we learned all about tropical medicine and wartime medicine, and really enjoyed that. I grew up in the military. My father was in for 23 years, so nothing foreign to me. I always knew I wanted to be a surgeon, so I started training as a general surgeon and then worked my way into plastic surgery. And I'm sure we'll talk more about those details in a bit. As you mentioned, I've got an amazing wife of over 45 years, Kathy, and some great kids that are in medicine as well, and grandkids. So I'm living the life, living the dream.
Yeah, definitely. And well, first off, thank you for your service and for your father's service. That's amazing. Sure. Something that I very much appreciate and admire. And again, going back to just your history and becoming a plastic surgeon, a board certified plastic surgeon, what made you choose plastic surgery?
Yeah, that's a good question. And so things happen for a reason, I think. But as I went through my general surgery training, I didn't know what I wanted to do. I enjoyed everything. I enjoyed everything from vascular surgery, just being able to make changes for patients. There's a difference between an internist and a plastic surgeon, and the internist will turn a dial and watch for what the changes are made with the patient, change a medication or what have you, whereas a surgeon we used to joke, cut to cure, right? And so it allows you to use your hands and make changes in someone's life. As a general surgeon, it can be a matter of saving someone's life, gunshot wounds, wartime injuries that we've dealt with. As time went on, I realized, though, that I really like working with my hands, so surgery was definitely what was in my future. But as I got more exposure to plastic surgery, I realized that as a plastic surgeon, I know that you know, but the average listener doesn't know that plastic surgeons are really trained to operate virtually head to toe for somebody, whether it be hair transplants, whether it be to work on the scalp, rotational flaps from cancer, all the way down to the feet. You get to use all your knowledge base. And so I did all that when I came out of my training in the military. I did breast cancer reconstruction. I did lower extremity and upper extremity reconstruction. But as time went on, I realized that my really true love was breast surgery. And so what's happened over the course of my almost 30-year career is I've focused solely on all aspects of aesthetic and revisional breast surgery. I'm fortunate to have learned a lot and gotten to befriend a number of really very talented surgeons who've taught me a lot. And so now I get the chance to lecture and share what I've learned over the past, almost, as I said, 30 years. So aesthetic surgery is a gift to be a part of. You are helping to restore not just function, but form as well. But in our practice, as I mentioned before, we have a large group practice. I have 2 great partners, so we offer everything from facial surgery to body contouring to liposuction, all the above. So we offer the full gamut here. When I got out of the Air Force back in 2003 and opened a private practice, I took all comers. I did insurance cases and as well as cash pay patients, and found that I don't know that the desires and wants are much different. I think that over the course of time, women who I primarily care for, women and men, but women have become a lot more educated in what their options are. And I will say that that's good, because they need to ask questions. I tell every patient when they leave my office after an hour visit, I say, you're welcome, number one, to come back, because we typically have talked a lot about a lot of moving parts in a surgery. But I'll say, as you think of questions, write those down so that when you come back, you can make sure that every one of your questions gets answered. I'm not a salesperson. I like to educate patients on what their options are. And so that's something I've always thought was critically important from the get-go. But also, I will say that there's a lot of bad information out there on the internet and social media as well. So sometimes it's a matter of having to educate somebody about what is really best for them, at least in my opinion. So I think that although they've become more educated, I think that there's bad information out as well. So I encourage patients that are watching this to let your doctor be the source of the true information for what they think that would be best for you.
So what are some things that you can share with the audience on how you curate content, how you're empowering the patient to go home and, gather questions, but hopefully they're able to take them back to you and not to ChatGPT or to Google or whoever the case may be?
So for me, and you and I go way back, and our relationship started with TouchMD, which plays an incredible role in my practice. And it's to the point now where if I come to work and there's a power outage or I don't have internet, it's almost like I say, okay, time out, let's cancel the day. I can't see patients today without my TouchMD. Because
I love it.
The benefit of it is that when I tell patients when I meet them that I'll start from the very get-go. Everything I ask them, I'm trying to learn more about them. And then I'll talk as I go through a consultation, kind of how I'm, in my mind, planning out how I would do their surgery. And again, probably 70 to 80 plus, if not 85% of my patients are revisional or redo surgeries. And so using TouchMD, I'll go through, start off my consultation with a very comprehensive questionnaire. I really want to know everything about a patient. I want to know their medical history. I don't want to just focus in on their breast, because there are facets of their health that will affect what we do, how it's going to affect their anesthesia, what I do in terms of perioperative and postoperative care. As I go through and do that, patients are oftentimes very amazed that I'll ask questions about their thyroid or about other GI issues or what have you. But that's the benefit of having had the general surgery training before. And then as I go through, I like to draw on my images, the patient's images on TouchMD, and they're each and every one saved. And we make it very clear to the patients that they have access to those images, that they can go home if their spouse or loved one or whoever wasn't able to make it to the appointment. They can pull those images back up. And again, I emphasize to them that they can write questions down if something wasn't discussed before. And so education is ongoing, and it includes post-op education as well, right? We try to do that ahead of time, but it's a process. It's never just, hey, how you doing? Great. All right, see you in 2 weeks. It's a process, and it takes a time commitment. It really does.
Yeah, definitely. What I love is that you flip the script of selling to educating. And when you're educating, you're empowering, and then your patients feel empowered to go home and to relive and retain and to share it, and then to come back to you, their trusted source, to gain even more knowledge or more clarity into whatever the case may be. But being able to retool and reconfigure that mindset to shift that to educating and empowering the patient.
And I think it's also really important when somebody comes in for a visit, it's a good idea to have somebody come with them. Somebody that, when a woman is sitting there in front of you unclothed and you're examining them, it makes it harder to think of the questions that you had thought about before. And so that's the other benefit of TouchMD. I examine them, I take my measurements, I get as much history as I can, we take their images, and then if we're going to try implants on in a primary case, they're put a robe back on so they're covered up. And at that point, we scoot up to the TouchMD screen and go over all this information. I believe it's much easier for a patient to understand and feel comfortable asking questions when they're covered up. It makes no sense to try to have them sit there unclothed or naked and to try to understand what you're saying.
Yeah, that makes sense. So I'd love to kind of unwind a little bit. And so we've talked about patient education. We've kind of touched on a little bit of software. But one thing that I've learned a lot from you is how you give a consultation. And there really is this art that I've discovered just from watching you and others. So, what are some things that you can share with not just patients that are listening, as they're thinking about which surgeon that they might want to, consult with, but to our med spas, to our plastic surgeons, to our dermatologists, to any aesthetic professional listening to this podcast on the consultation?
Well, there are a number of them. And I think number one is it's important. It sounds somewhat cliche, but that patient needs to think, or they should think, and they should be the most important person in the room, right? So I think it's really critical that we make sure that they know that they're listened to. And so listening is not waiting to speak. We've all heard that before, but that's so critically true. Listen to the patients to hear where they're coming from, what they've been through, if it's revisional surgery. I make it very much a point to not dig into them speaking poorly of a past provider. There's no benefit gained there. And so I think listening to patients, making sure that they know that they're heard. I don't ever, it made a big impact on me. Another thing I read years ago is you don't talk to a patient with your hand on the doorknob. I mean, it's just like being at a dinner table with friends and you've got your phone in front of you. Where's your attention? Your attention is not on your friends. It's not on your spouse or your kids or whoever. So I by no means am I perfect, but I try really hard to have patients know that what they have to say has value.
What are some things that you do each and every time, no matter who the patient is or what the procedure is about?
Well, it's really important to engage them in the consultation, engage them and allow them the ability to ask questions. I'm not speaking down to or over somebody. If they have something to say, I'll listen and incorporate that into the conversation. I do take pictures at each visit to include post-op visits. Those are kept in TouchMD, and we provide a small index card or business-sized card that tells patients how to access their images. And the last time I talked to the folks at TouchMD, I had a pretty high revisit rate by patients to go back to it. And so I encourage them. I said, go, talk to your husband, your boyfriend, your girlfriend, your mom. They can get on with somebody across country if they want to go over those images. Again, it's pre-op, intra-op, and post-op. You can share data with them.
Yeah. So you've definitely become a master of your craft, obviously as a surgeon, but then you've become a master of actually using the technology, the TouchMD technology. What are some things you can share with a provider or an owner of a practice on how to adopt technology, and knowing that you're not going to become a master really fast, but
Right.
What are some things that helped you get to the point to where you're at today?
Well, I'm not really big on technology. I can play around with computers and I'm not a programmer, but we keep talking about this like it's a TouchMD commercial, but that plays such a big part in my practice. I think it's important. So there are times that I'll be at a meeting and somebody will come up to me, or whether I've talked about it in a lecture I've given about how I use it in my practice, somebody will come up. And one of the first things I say to them, if they're going to adopt something, let's use TouchMD, I'll say, great, you can be excited about it, but you have to have your staff be excited and use it as well. Whenever we hire new personnel into the office, one of the first things that I do if they're going to work on my team is we come into the room and I make sure that they are comfortable moving around in TouchMD, to include getting comfortable with my before and after gallery that they can pull up and show patients. We always make it a point to tell patients that each and every woman that we're showing them pictures of has given us permission, right? So that they know that their pictures are not going to pop up on an Instagram post or the internet or somewhere like that, certainly without their permission. So I think that before you adopt a technology, you should do your research. I don't have a lot of FOMO, as they say, or fear of missing out. So I don't jump right to technology when it first comes out. But I'll never forget the day that Jason came into my office so many years ago and put the first iteration of TouchMD up on it wasn't even a touch screen. It was a big Hewlett-Packard screen. And as he showed me how you move around it, my wife was running our practice at that time. And I just looked at her and I said, this is coming on board. The other thing that is important, as one of the questions you guys had asked about, was technology for somebody coming into practice, whether they be getting out of the military as I did, or they're just coming out of training. I think that your practice management software is critical, right? And for us, we're a large Next-Tech practice. And as you well know, and your listeners know, that TouchMD and Next-Tech are synonymous now. And boy, it's been less than a year, but my, how times have changed. And so those are two pieces of software that I can't imagine practicing without. There are lots of bells and whistles out there when you go to the aesthetic marketplace at our annual meetings, and you'll walk by and see the newest, fanciest laser or the new cellulite machine. And I'm not saying that those don't have a role or utility, but do your research before you spend your hard-earned money, whether you're borrowing that money or what have you, to do that. Listen to other colleagues that you trust. Go to a lecture and learn as much as you can before you bring something on board. And think about how you're going to implement it into your practice. I'm telling you, I really feel like as much as I use TouchMD, I think I use just a fraction of its capability. I mean, I do use the homework function. So let's say somebody comes in and I say, because it's my habit as well, at the end of every visit, I ask patients if they do self-breast exams. Again, all I do is breast surgery. And it astounds me sometimes that women say that they don't do a self-breast exam, even if they have a family history. And so I built into the homework section of our TouchMD a sheet on how to do a self-breast exam. And so I will go click, 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 and I say, I just sent you, or I'll have my staff send you some homework, and this is what I want you to do. But you can put, it's just limitless on the educational information that you can put in TouchMD. And it doesn't mean that your consult takes an hour or an hour and a half to show them that data. If you're facile with the computer, and I use the touchscreens on the wall. Some doctors like to use the iPads and maybe Apple technology projected up to a screen. I like to use the touchscreens and have the patient right there with me side by side as we look at this. So use the technology and just know that, especially, I think it's so exciting as young plastic surgeons to come into seeing this done, because when I first laid my hands on the technology, there were a couple screens deep and that was it. And now it's just like, it's like Matrix, it goes way back and you see the green screen coming down. But so I think it's fun. It gets me excited, obviously.
Yeah. I love how passionate you are about it, because obviously I'm biased, I'm passionate. I think that it's something that every practice can benefit from, even in the ways, that you said, like things you haven't even mentioned, which is, using it as a digital menu or using it as a sales aid. But there are so many
you could do your informed consent. And the beauty of the mobile app, the Snap app, allows patients to send me pictures back and forth in a HIPAA-compliant fashion if they need to share some ideas. I use it, and something we haven't talked yet about is virtual consultations. So I insist when somebody has a virtual consultation for whatever breast surgery they have, primary breast surgery or not, number one, I make sure that they fill out their intake paperwork before the consult. I won't see them without pictures and their intake paperwork. I want to make this worth their and my while. And I will literally, when they send pictures in, we forward them an image of, say, these are the series of pictures I want you to send. No face, arms down, arms up, all these different things. And when those pictures come to me, I get them easily the day or two before their consult. And I'll sit down and draw on them at that time. And then those go back into their gallery so that during the consultation, I can pull those up and say, here's your anatomy. This is what's different. These are the implants I think would benefit you, and this is why, et cetera, et cetera. So again, great technology. Another technology I use, just to be fair, and so this isn't a TouchMD commercial completely, is I've really adopted breast ultrasound as a tool. And so I encourage plastic surgeons to pull that on board as well. It's something very easy to do.
Yeah. So, can you tell us a little bit about that?
Sure. So a number of years ago, as we well know, when we survey silicone implants for what's called an occult or a silent leak or rupture, I hate the term rupture because implants don't explode, but to know if an implant is disrupted or not, it was recommended at the initial approval that they have a breast MRI. Well, many years go by, secondary hearings are held by the FDA, and a very few patients are having MRIs unless it's something that their insurance took care of, because it's rarely covered by insurance in aesthetic cases. So I learned, thanks to very smart people that I'm friends with, fortunately, Mark Jewell, Brad Bingston, and others, Patty McGuire and Carolyn Glicksman, we all have adopted using ultrasound in our patients. And there are many more, trust me. Bill Adams is a big user. And so it's so easy to do at bedside. And I use a Clarius. There are other options, but Clarius is a wireless ultrasound. I can slide a stand into the room, and I have an iPad there. And I talk to the patients as I'm pulling it up, and I show them what I see. Then I can save the images. And if I want, I can import those images into TouchMD so they're kept there as well. So it's something that I highly encourage plastic surgeons to use. Now, you mentioned med spas earlier. There's a push with Clarius and other ultrasound devices to use it for facial injecting, to look at anatomy. You can look at vessels. You can try to avoid an intra-arterial injection and cause not only harm, but hours and hours and days of lost sleep on your part.
Yeah.
So safety, it brings safety into a whole nother realm when it comes to that.
That's actually the first that I've heard of it being used for injectables and fillers and facial anatomy. That's incredible.
Yeah, the ultrasound is a great tool, and there's no radiation. It's sound waves. And again, Clarius is a company that I've worked with, and they're very responsive. That's the one thing I always brag about when I talk about going back to TouchMD, is that I could have an early consultation, and I always laugh when I go back and see some of the early rudimentary drawings that I made. And I'll call Ted at TouchMD, and I'd say, Ted, we need to be able to do X, Y, or Z. And within a week and a half or 2 weeks, he'll say, hey, reboot your computer and try it again. And sure enough, there it is. And you guys it's so nimble. And I kind of get the feeling as I talk to more leadership in NextTech that I think that they're in the same mode as we go along, looking at the electronic health record and record report generation, et cetera. So being nimble and being responsive to your customers, I think, is huge.
I would like to shift gears a little bit and talk about the Aesthetic Society. You are a past president. I believe it was in 2014, you were the president.
Right.
So I'd love for you to, number one, tell us about the Aesthetic Society. And number two, tell us about your experience as the president.
So about 60 years ago, there were some very forward-thinking plastic surgeons. The Aesthetic Society did not exhibit, and I should know exactly how many years, but it's been maybe a little over 60 years. There was ASPS, the American Society of Plastic Surgeons. Great organization, good for education, but there wasn't a big push on aesthetic surgery. So some very forward-thinking and brazen surgeons chose to branch off and develop this concept of teaching aesthetic surgery. At that time, there were actually surgeons that said every cosmetic surgery that will be ever developed has already been developed and discussed. I mean, it was so shallow of an approach. And so again, thanks to these pioneers, the aesthetic meeting began. Literally, the society began on the back of a napkin at Harry's Bar in Venice. It was a travel club of plastic surgeons that got together. And so thanks to them and their leadership, as we've gone on, the Aesthetic Society, or ASAPS as I prefer to call it, has developed into the world-recognized number one source of aesthetic education. And this is not to demean ISAPS or other organizations that have been developed, but ASAPS has always prided itself in the quality of its aesthetic surgical content. And so I got involved with that. I was still in the military at the time, and I got involved and was asked to play a part in a very small committee. I've always liked leadership. I was in leadership in the military and doing different things. I helped to command a field hospital in the Gulf War conflict, and I enjoyed that. And so as I got involved, before you know it, I'm on virtually a phone call with the society in one committee or another, three to four times a week.
Wow.
And it's just, so I want the listeners to know that when you see somebody who is involved in the leadership, it doesn't just happen overnight. It has to do with a lot of dedication and time away from your family, time away from your practice sometimes. But I just enjoyed being part of it. I've said to my wife jokingly one day, she goes, why are you spending so much time with these people? And I said, gosh, number one, they're like-minded like me. They I think patient safety is something we'll talk about in a bit, but that's very important to them. Getting the best education out there is important. So it was fun being involved. And before you know it, I got a phone call one day. I'm very much shortening it, and I was tapped on the shoulder to be a president. What an honor to represent the Aesthetic Society. I was fortunate to travel virtually around the world to meetings and got to meet some amazing people, many of who I'm proud to still call good friends, representing the society, giving talks, giving updates on the society. And one of the questions I'm often asked is, what impact did I make during my time as a president? Everyone comes in and they have a goal of what they want to achieve. And I like to think that I just kind of kept the ship steered in the proper direction. When you run a board meeting, you don't go in and you pound your fist and start dictating things. You listen to your board members and you see what's going on and you get your committee reports. And it's your job to kind of shepherd the society into what the right way to go. And so I think, if anything else, that was something that I played a part in. And it was, as I'll say again, it was a true honor on my part. And I still think, and it will always be, the premier source of aesthetic surgery education. And Kia Mofasagi is our current president out of the Northwest. And he's a high energy guy. And I think that the society is in good hands.
Where do you see the society going over the next 20 years and their importance to the industry?
So there are two societies that are sister societies. There's the Aesthetic Society, which focuses on the education and membership and all those rewards. But there's also, they rebranded it, renamed it, and it's ASERF, the Aesthetic Educational Research Foundation. And so what's happened in the period of time that I've been involved, it was important at the time, and research was being done, but they have come light years in terms of supporting papers. Oni Garcia is the current president of the Aesthetic Research Foundation down in Miami, and Oni is a researcher. He's a brilliant plastic surgeon, and so you can get funding for educational researchers, for papers, to get new data out there, papers on anaplastic large cell lymphoma, papers on breast implant illness, things that are current and foremost. And so they are constantly moving and evolving and responding to the needs of our membership, right? And to the needs of our patients. So I see them as continuing to get better and better and better at how they shepherd funds towards research and supporting residents. The society is very good about helping medical students out that are interested in plastic surgery, because there are plenty of places in our country that a medical student has no exposure to plastic surgery. They may have a strong interest or desire, but they don't have a plastic surgeon they can shadow. And so the society is trying very hard to make sure that from the bottom up, that people know how they can kind of work their way into what is a really very rewarding career.
When we think about emerging trends in aesthetics, what are some trends that excite you and you believe are here to stay?
Well, continued evolution in terms of software and technology is always ongoing. It's amazing. I'm old enough to know what it was like to be a practicing plastic surgeon and not have an email account, because they didn't exist. My first portable phone as an intern was the classic brick of a battery with a cable I pulled out and you pull the antenna up. So I've seen so much in terms of change and evolution. And I think it's just, it's going crazy. Artificial intelligence, I think, is something that we cannot ignore. It's out there, and it has, you mentioned ChatGPT earlier. I think that it's going to be a part of every aspect of our technological lives. And we have to be cautious in that, right? You have to really be careful, because there are, even Elon Musk questions sometimes the safety and validity of some AI technology, but it's here and it's not going anywhere. There are technologies that continue to evolve in terms of lasers and infrared light and what we can do to turn back the hands of time aging-wise. So I think technology will play a big part of it. I am also very involved with Allergan, which is the elephant in the room in terms of implant technology, filler technology, and I have been involved with them virtually since I got out of training. And I'm to the point now where I'm a consultant, and I get to travel and learn about emerging technologies that we really can't talk a lot about, but just suffice it to say to the listener that no one's sitting on their hands and saying, well, we've got these highly cohesive implants now, well, that's it. Trust me, there's more coming, and it's only going to get better. And the patient and a long-term outcome is what is the end point, not just to make the stockholders more money. So patient safety and good longer term outcomes and results are at the forefront.
Wow. That is amazing. I wish you could tell us more, but when those are launched, we can have you back on to
You bet.
give us your take, which is incredible.
Yeah, there's some very smart people that are at benches doing things that we'd all be amazed about.
Well, I'm hoping for something to come out that helps retain your hair, right? I actually just had hair surgery about a month ago. So hopefully there's something in the works over the next decade that we can all partake of.
Yeah, you're just using your testosterone elsewhere.
Yeah, exactly. I would love to hear your take. You alluded a little bit about ChatGPT, but I would love for you to share with us some ways that you're using ChatGPT or some of your colleagues are using ChatGPT or AI in general. It doesn't have to be ChatGPT.
Well, if you look at your computer now and you see just about anything from Google to Chrome to whatever your search engine is, there's a little AI button in the upper right-hand corner. But AI is involved in terms of it will allow robotic surgery. It's going to enhance how we conduct our virtual consultations. It's going to enhance how, we all know when you go to Amazon and you search for something, all of a sudden all the suggestions from previous searches come up. Hey, this, or I get my Siri will pop up or Alexa will pop up and say, based on your last search history, this is on sale now. And so it gets a little bit annoying, but you can't let it bother you too much. So we live in exciting times, and I think it's not going away anytime soon.
We really do. I mean, if you think back in, 2019, would we have expected that 5 years later we would have the advancements that we have today?
Right.
And to think about, by the flip of the new decade in 2030, what we'll have and where we'll be. And for me, my take is to adopt and try your best to utilize the tools and be receptive and utilize them in the best way that you can. But remember to hone in on who you are and don't let it change you and still,
Right.
Keep your authentic self while you're
Right.
adopting AI, which is hard. It's hard. It would be hard to be a teenager to not test it out or to see how far you can go to that line, and where is the line in the sand. So,
Right. That's why as parents, and I know you're a wonderful parent, I think that that's so important to be involved and see what your kids are exposed to. And so maybe for us as more senior plastic surgeons, it's our job to kind of help shepherd the younger ones along, although that cat may be way out of the bag.
Yeah, we'll have to see. So I want to turn the page a little bit and talk about patient safety. You are a champion when it comes to patient safety. What are you hoping to change for future generations to continue that effort?
So patient safety is again, here to stay, thank God. When I first started in my surgical practice, this concept of what's called the timeout didn't exist. I don't know if you know what that means, but basically before an operation starts, your nurse in the room everyone stops and listens to that nurse, and they say the patient's name, they say an allergy history, they say what they're having done, and all the key components to the surgery. And everyone has to agree. And I will tell you that this all came out as a part of airline safety, because even in my life, back in the military, there were aviation mishaps that could have easily been avoided. So the military developed this concept of safety in terms of getting a plane up the ground. And in the military, I assure you that the one striper that is putting air in the tire in the plane, and I'm being simplified about this, but everyone in that crew has the ability to raise their hand and stop a plane from taking off. And so that's empowering them if they see something that should have happened. Now, again, this is not pie in the sky, but it's ideal for what happens. And there are times where I saw that occur. And the same thing holds true in the operating room. If a surgical technician, they need to know that if they see something that's unsafe or maybe something that wasn't done properly, at least in our operating room, and I'm sure in many other well-conducted operating rooms, they have the ability to stop or at least to question things, and then things are rectified as we move on. The other part about this, as again, with the Aesthetic Society and other reputable plastic surgery organizations, patient safety units are required for our medical license renewals, for board certification renewals. You have to prove that you have done some CMEs, continuing medical education, on aspects of patient safety, whether it's how you conduct your liposuction technique, how much fluid you can put in, how much you can take out, how you take care of these patients, what patient has to be hospitalized. But to drill it down even further, I think that patient safety has a lot to do with how you conduct yourself in the operating room. You're not rushing through a surgery, but you want it to occur in as expeditious a fashion as you can to minimize the time that a patient is under an anesthetic. One of the great things that we have in our practice, as I said before, I have two great partners, is that we offered what's called a duo surgery. So if somebody comes in and they want the, quote, mommy makeover, and they want tummy surgery, maybe a little bit of liposuction, and they want breast surgery, we work together and have an operation that normally would have taken me maybe 5.5 or 6 hours if I were doing all the parts on my own. And now we can do them in 3.5 to 4 hours, not compromising care whatsoever. It's just that you've got two board-certified plastic surgeons and their respective teams operating on different parts of the body at the same time. And our patients love it. It shortens their anesthetic times. They have one recovery, on and on. But patient safety has to do with the surgeon is, as we call them, the captain of the ship in the operating room. So I empower my team, as do my partners and many other wonderful plastic surgeons around the country. Empower your team to be a part of the patient safety practice. And so it's just a matter of taking very good care of your patients and staying current on the literature, medications that are being used, medications that shouldn't be used at the same time. So it's critical. Obviously, something that I feel very passionate about too.
Yeah. Well, thank you for sharing all of that with us. It gives me more confidence for, any future family members or friends that undergo surgery, knowing that they have that level of care. I have one parting question for you, really to end the podcast. And I would love to have you on again because this has been amazing. I feel like I have more questions for you. But for young surgeons or even med spa professionals who might be listening to us, what advice would you give to those who are in the earlier stages of building out their practice?
So there are a number, and I've mentioned a number of them through the course of our discussion. But first and foremost, take good care of your patients in the safest manner that you can. Number one, that should be your mantra or at the capstone. Then I think as a practicing clinician, be as good as you can about what trade you're going to practice, whether it be as a med spa provider. If you're going to do injections, know what you're using. Know where that product is best used in a safe fashion in somebody. And equally as important, if there is an untoward event like an intravascular injection, know how you're going to treat that. Know what you're going to do. Make sure that the people around you know what to do. So you have to educate your support staff. So that's in the practice of medicine. The next part is about the business part. And I know a little bit of what you guys focus on here is about the business of it. Money could go out like a fire hydrant turned on when you open a practice, depending upon what you do. I encourage everyone that has a practice to not just delegate the financial aspect of your practice to, in my case, it was my wife. And so I was always hoping she was embezzling. But she wasn't, and so but I assure you it happens all the time. And so don't delegate the financial care of your practice to somebody else. Make it so that when checks are signed in your office, you should be a signer on the checks. Why are we paying this money to that person? Why is this bill that? So you owe it to yourself and those that count on you at home for bringing money home to know those things. So be fiscally and financially responsible in terms of how you conduct your practice. And just, it really falls down to the old saying, do the right thing, right? And I'll say once again, take good care of your patients. And then the last thing I say in a practice management lecture I give it at the Aesthetic Society, take good care of your family, right? Because that's what it's all about.
Any final thoughts, Dr. Edwards, that you'd like to share before we end the show?
I don't know. Just life is short. I think that if there's any takeaway, work hard, study hard, take good care of your patients, and take good care of yourself and your family. I'm telling you, I don't know where the last 30 years has gone. I've been very blessed to meet some amazing people, present company certainly included. I like to believe that I treat everybody as I'd want them to treat me or my family. And I think that that's what it boils down to. At the end of the day, I tell patients the whole concept of patient safety. I say, by me taking better care of you and giving you the best results I can lets me sleep better at night.
That's amazing. That's the best way to end this episode. And I just want to thank you again for your time. Thank you for believing in TouchMD as one of the very first to utilize it and to still be using it all these years later. Thank you for being so great to Nextech, and would love to absolutely have you on another episode in the future. Maybe you can share some of those things that are under the hood where you're flying out to these different countries that you can tell us about innovations that are coming in the future. So for those of you that are listening, be sure to check out the show notes to connect with Dr. Edwards on LinkedIn, via social, and be sure to follow along with us as we continue this journey on the Aesthetically Speaking podcast. And until then, we'll see you guys next time.
Thanks, Tyler.
Thank you.
Thanks for listening to Aesthetically Speaking, the podcast where beauty meets business, presented by Nextech. Follow and subscribe on Apple, Spotify, YouTube, or wherever you like to listen to podcasts. Links to the resources mentioned on this podcast are available in your show notes. For more information about Nextech, visit nextech.com, or to learn more about TouchMD, go to touchmd.com. Aesthetically Speaking is a production of The Access, TheAXIS.io.